Jim and Linda say their 4-year-old daughter Kaylee is having a gender identity crisis. Now, Kaylee was born with androgen insensitivity syndrome, which means that she looks like a female on the outside, but inside she is an underdeveloped male. Take a look.
Dear Dr. Phil, my 4-year-old daughter Kaylee is the baby of her family, and we call her Kaylee Bear. Kaylee looks like a perfectly beautiful little girl on the outside, but was born with underdeveloped male genitalia on the inside and has XY chromosomes, AIS, or androgen insensitivity disorder. Kaylee will grow breasts, but does not have a uterus and will not have body hair or children of her own. My daughter will always be genetically a boy.
The problems we're having with Kaylee right now is she seems to have some sort of a gender identity crisis. She started asking us questions like, is she going to grow up to be a boy? Is she going to grow a penis?
I was having to daily reinforce Kaylee that she was a girl, and if I talked to her about being a girl and not a boy, she would throw a temper tantrum.
I feel like I messed up. For several months, it was daily questions about when she grows up, will she be a boy? Is she going to marry a girl?
She says she wants to marry a girl with really long hair.
The other ugly thing is taking my daughter to doctors to discuss these issues. They don't say she, they don't say he, they say it. And she's not an it. She's not an it.
Very difficult situation and a very complex situation. Tell me what your current strategy is. Your current strategy is to raise Kaylee as a girl?
Right, right. Okay. I mean, when she was potty training, I have a daughter that's, near her age, and they were potty training at the same time, and I thought she would sort of emulate my other daughter potty training, sit down, whatever, and she was potty trained standing up. She would try to stand up to use the bathroom, from very, very early on.
Okay, have you guys made the determination now of where she is anatomically? Because we know that there are underdeveloped male genitalia.
Right.
I assume that they have done the examination and identified testes that are obviously non-descended and present, and it's your goal, your plan to have those removed
at some point,
at the proper point.
I don't want her to be, different, because it's difficult to be different. I mean, just looking at the Cameron and Stephanie's story, it's just like, it breaks my heart, because I don't want that for her. If that is what she is, I accept her her syndrome, because I have other members of the family. I grew up with a syndrome, so it's passed down from like 4 generations.
Yeah, you have 3 other family members that have similar circumstances.
Right. So it's not that I don't accept the syndrome. It's just that, gosh, it's going to be difficult for her to be different like that.
Yeah. And the question is, should Linda and Jim have to make that decision now? Is it better to take a direction, or is it better to wait? This is a very difficult situation. We'll talk about it when we come back.